Hi, I'm Mick. I'm the senior massage therapist here at B2H 360, and I want to tell you a little bit about the different techniques that I'm using in my massages. I usually blend a lot of different techniques together, from of course sport and remedial massage, but as well actually Emmett technique, a Bowen technique, a core myofascial release, and of course as well fascial release with active movement. The remedial and sports massage is something that probably most people actually know about. So that's definitely a lot of moisturizing used, like oil here. It's a lot of effleurage happening during the deep tissue massage. We're trying to find the tight spots, and we can that way really release the tissue and actually give freeness in the movement of the patient. Usually depends as well what type of activity they do. So Amanda here, that is on the table and is getting treated at the moment, she's a great instructor and she's an RPM instructor. So she lifts weights around and is very, very active. So she usually gets very, very tight in the shoulders, a lot of low back issues and pain, and usually having a treatment every 3 to 4 weeks allows her to perform on a really high level. So this was now the part of sports and remedial massage. Of course, works the whole body, and sometimes we focus really on the parts where the person has a lot of issues. Now we're talking about getting into release tight glutes and for people having low back pain or sacroiliac joint pain. The sacroiliac joint is the joint that actually allows basically the lower and the upper body to move independently from each other. So the fascial release works a little bit differently than the deep tissue massage. So here it's a little bit of fascial frictions happening into the glute to free up basically tight spots around the gluteal area into the hip. Then what I do, usually I test the movement of the hip in different planes. And once I really find out which places are the one that are actually not really moving properly, I can move her in a different position, and I actually start to sink into the piriformis or glute muscles, and I basically wait till we get actually a beautiful release in there. Sometimes it takes a little bit longer, sometimes it goes a little bit quicker, it depends how tight it is in there. Here again, we're gonna move that hip in different planes. So we go actually superior here, or we get a little more motion in the opposite direction. And this usually really frees up the hip quite dramatically. So the other soft tissue technique that I use is active soft tissue release. So in this case, we actually shortening the muscle. We take traction on her hamstring and then we extend the leg. Because of actually the motion we are doing, we basically breaking up scar tissues in the muscle, and we allowed the muscle really to have the normal function again. So people that really get lots of really tightness in their hamstring, they're gonna get a lot of release out of this technique. Coming back to a different technique, we're talking about Emmett and Bowen. Bowen is a technique that actually uses switch on and off method to actually release and realign the body. So in her case, what I'm using now is actually a basic relaxation move for the back. So what we're doing, we take traction, we open up the muscle in different directions. So this is actually a way to open up nicely a back. That's usually something that I use at the beginning of my treatment to get to a basic relaxation mode, and in the same time I can actually assess if and if something is wrong in the movement or in the muscle, and how much restrictions we have in a muscle. If we come back and we talk about EMET technique, which works on receptors, so that basically resets the communication between the muscles and the brain and helps actually to somebody has really acute pain. I can use actually gentle pressure into those points like these ones here, and we can release basically a rhomboid or upper traps with this short move. Another move would be to release a teres minor muscle. So we're talking about really lots of muscle here that are really needed to actually move the shoulder in different planes. We have really a different variation of those moves. So in a total of, I think, over 56 different moves that goes really to release a calf or to release a foot. Somebody that has plantar fascia issues, headaches that you can actually release pretty quickly that way. The next technique that I'm talking to you about is called core myofascial release. The fascia is something that actually surrounds all our muscles in the body, in the front and in the back, and on the lateral sides of our body. Without the fascia, we wouldn't be able actually to stand straight. So what we often see as well is in people changing their posture because the fascia actually pulls the body in certain directions. So if somebody is really bent over or bent to the side, that's because the fascia sometimes is actually pulling the bones in that structure. So with core myofascial release, we can actually release that fascia, and afterwards we can actually find out which muscles are not doing the proper work underneath. The fascia release is actually really something that works really slow. In our case now we're starting with the back, and the fascia in the back works the way down from the top of the head down to the feet, and in the front it moves actually from the feet up to the head. Doing actually this type of release, we can actually really change the posture dramatically in just one session. Different than with the remedial massage, where actually the movements are a little bit quicker. Here we are working actually really slow along the spine to start with, and then we work actually the shoulder, and you see everything is actually moving the tissue towards the feet or the lower part of the body. When this is finished, we're going to start to spread out actually the upper body on the lateral side, and you see that's actually like a spreading that's actually happening here. And once we're down there, we work back up towards the head, and afterwards we go in the opposite direction. We spread actually coming from the opposite side. So after doing the back, we actually move the patient in a lateral position, and we actually work to really free up the hips and the neck and the shoulders in all different planes. So here we come in and we can lift up, try to relax there for a sec, just let it go, that's it. And we can actually try to increase the range of motion in the shoulders that way. If that's something that you are looking forward to get a type of treatment that's actually really working on different ways to regain actually your posture, or to release a problem or fix a problem with your body, or you just need basically to be on top of your performance for your next race or next event, then please feel free to contact us and call at 472-83200.